Okay, I'm going to get started here. Hi there, everyone. I am Amy Stout, the Wellness Consultant at Axion Risk Management Strategies, and I'd like to thank you for tuning into our wellness presentation today. A few housekeeping notes just before we get started. If you have questions, we ask that you please enter them in the chat feature, and they'll be answered at the end of the presentation. And an exciting announcement. At the close of our discussion, we will be spinning the wheel of names to win a Fitbit Inspire 2, courtesy of CHC Wellbeing. You must be present to win. As you all know, this past year has demonstrated the very importance of wellness, and I'm happy to introduce Todd Gianvito, Regional Sales Director from CHC Wellbeing, who will show us how to effectively implement wellness and well-being in a post-COVID environment. Todd?
Thank you very much, Amy. I appreciate the intro. I'm going to shut off my camera now and start the presentation. And I wanted to go through and welcome everybody first for joining. Thank you so much for your participation today. We are going to make this somewhat interactive. We're going to have a couple poll questions that will be introduced throughout the program. And I wanted to go through some of the topics that we're going to be talking about today in today's presentation. We do mention we're in a post-COVID world. we are hoping that is the case shortly. Everybody is, really ready to start moving and getting back to the norm, or whatever that norm will be. There is a problem these days with overall well-being, not only from a physical aspect, but from a mental, emotional, social, even financial aspect. So we're going to be talking about that problem and what the need is, and identify the need. We're also going to be talking a lot about, what are some of the critical steps that are involved in implementing a program in this environment. It's changed. A lot has changed. So we're going to be talking about kind of, what the factors are in putting together the homework that's needed up front to put together a very comprehensive well-being program. What types of incentives work? They vary between industries and even amongst unique populations. So we'll be talking about that a little bit, and setting goals, strategic goals. Looking at the comprehensive aspect, as I said before, it's not just the physical. We want to be talking about that emotional side. Financial side these days is very, very important. We are seeing a lot of people, we're looking at poll data, and 80–90% of people are stressed about their finances these days. So we have some ideas on how to alleviate some of that stress, which spills into the physical, emotional, social side of overall well-being as well. And then driving that participation and sustaining that engagement throughout the program is of utmost importance. Just a little bit about CHC and our founder. I think this speaks to what we do, what our passion is as a company. As you see in our picture here, this is a picture of Dr. Patrick Angelo. Dr. Patrick Angelo is a surgeon in the Chicago region. He actually started CHC over 18 years ago. And he realized through his practice and charitable work that people were greatly impacted by their lifestyle choices. Not sure if you've seen Dr. Angelo before, but he is known as the Angel of Lower Wacker Drive. The reason he's known as by that name is that he, a number of times a week, and he's done this for years, goes down and helps to feed and clothe the homeless in Chicago. He's been doing that actually for almost 2 decades now. So he's been doing that a long time. And he really knows firsthand that, if we're giving people the tools and the resources to make better lifestyle choices early on, they could be in a much better position in life. So not only has he wanted to impact the homeless population, but, he realized in his day job as a surgeon you know, he was really involved in the wellness of his patients, and he wanted to expand that into the broader corporate America. And that's when CHC was born. We've been able to really make an enormous impact on individuals in the corporate sector. To date, we've helped over 200,000 lives through screenings, education, lifestyle management tools that are incorporated within our programs. And we really do have a good idea in how to bring best practices to our clients through, helping hundreds of clients in different industries, get them the important education and the support they need to live happy, healthy lives. So, that is really kind of our passion at CHC. It reflects in what we do as a company and what our employees do as we go through and help our groups and organizations and our clients. Just wanted to show this quick little cartoon here. It's kind of how we are right now in a COVID world. Mom, why are you hiding in the laundry room? I'm working, I have a deadline, but we're hungry. Have dad fix your lunch. Just craziness. And a lot of this kind of stress that you're seeing here is reflective. We're seeing it every day with our clients. We're incorporating a lot of tools and strategies out there to address mindfulness, living in the moment, breathing, things like that, just to start to hopefully alleviate some of the stress that's happening these days in that COVID environment. It's a big deal. And we're going to be talking about some of the strategies today that have worked and some of the best practices that work in this different environment that everybody is starting to get used to, and seeing a lot of that change that's happening. Also wanted to show you a very quick little cartoon here. And if we were only this simple, let's start the wellness program by discarding your donut. And I don't know if everybody's heard in the news recently that Krispy Kreme is actually giving out donuts to those who are fully vaccinated for COVID. So everybody's getting vaccinated, which is a great thing, but they have the ability to show that card and get one free donut every day. So it's a little counterproductive, I think, from a wellness perspective, obviously. What we're going to really show you today is that by creating a successful well-being program, it involves a lot of upfront planning for that multi-year approach. And it's really a mindset change within the organization. It's a 1,000 nudges, as I call it. It's really taking small steps at first, and then leading to a more pinpointed approach as participants begin to incorporate, the various aspects of wellness into their lives. So again, it's a series of nudges. It's, in this case, you're seeing discard the donut and then move forward. It's not that easy. There's a lot of upfront work and homework that needs to be done. We can really, along with Axion, assist with that process, bringing best practices in, and doing that upfront work to make sure that we have a very engaging and comprehensive program going forward. So at this time, I wanted to introduce Jake Doman from Axion. He's here to talk just a little bit about the aspects of our partnership. So Jake, if you wouldn't mind going ahead.
No, Todd, I appreciate it. I love the introduction. It's been a pleasure working with you all. To give a little background on Axion and CHC, we partnered together for many years now on the wellness front, and now it's really transitioned from the physical wellness to the total well-being and how we approach working with employees and our clients. At Axion, we feel that wellness is of the utmost importance. This is truly an investment, and if you don't begin addressing total well-being early in individuals' lives and careers, you won't get the results long term. And a health plan without a comprehensive wellness program is simply incomplete. And we think it's doomed to see annual increases on the cost side that could very well be tempered by combining it with wellness. And so through and through, Todd, his team, the folks at CHC, folks at Axion, we're putting a very concerted effort towards bringing well-being to all of our partners, to all of our clients, to all the employees, because we think that this is the first step in moving our health plans forward. It's the first step in building culture. It's the first step in recruiting and retaining employees. And at the end of the day, when we're talking about employee benefit programs in healthcare, the employers are the end users. And so these plans got to make sense for them, and they got to be helping them. So Todd, I really appreciate your time and appreciate CHC's time today. Before we get started, we did say this was going to be interactive. So I want to kick off the first poll, talking about what you think might be most valuable to get out of this conversation and some of the things that you want to see to be discussed more or less, so we can tailor a little bit more of our conversation towards you. So if you can't see those polls on the screen, the first question is, how would you describe your wellness program today? A couple of choices. And the second question is, where would well-being be most impactful in your organization? Take a minute to check those boxes. We'll appreciate it, and then I'll turn that back over to Todd as well after.
Okay, we should hopefully be seeing the results of the poll shortly. Maggie, would you be able to bring those results up when they're complete? There we go. Very interesting. How would you describe your wellness program? Looks like we have a tie here between doing a few things and advanced. We have a number of people that are really just kind of in the starting aspect of the program. And we do have 7% that are doing everything there is, which I love to see. That is awesome. But looks like from question number one, there are a lot of things, that we can do to assist. And hopefully, as we go through the program today, you'll learn a few things. And again, keep in mind that there is the chat feature. If you do have questions that you wanted us to answer at the end of the program, we're glad to do that. Number two, where would well-being be most impactful? Love this as well. We have the majority of people saying improving overall employee health. We do have almost a third saying culture, and that is a huge piece of the puzzle here. Increasing or improving that culture within the organization is a big deal. Cost and retention and recruitment are in there as well. Those are important pieces as well. And, that is obviously an important driver. We want to make sure that that well-being program, does help to reduce those claims costs throughout the year. And a lot of people do use these wellness programs for that retention as well as recruitment. Having that very impactful and engaging program definitely helps with both retention and recruitment. So these are great to see. Thanks for participating in the poll. Okay, let's get back to the presentation. And I just wanted to show you a quick stat here that I think is apropos. 3 times more productive, healthy workers are 3 times more productive than their less healthy peers. Huge deal. So keeping those workers healthy and well, you're getting that productivity factor of 3 times. Individuals identified as high risk are 3 times more costly than individuals with low health risks. So finding and retaining that top-notch employee, much more difficult now in the labor market that's tightening again, that I've noticed, as COVID begins to slowly dissipate. So really, to address this challenge, employees are expanding the benefits, including comprehensive well-being programs, that they're really putting together to help employees thrive and increase overall wellness. So since these programs are more common than ever before, employers are practicing what I think is greater discernment when it comes to the value of these programs. So the question is, why well-being? And I just wanted to bring up really what I consider a growing problem. This is another stat that I think is unbelievable. 40.9, so almost 41% of US adults have avoided medical care during the pandemic because of concerns about COVID-19. This includes 31.5% who avoided routine care. That's a huge number, and it's alarming. Far too many individuals have really gone without their annual checkups. And unfortunately, we know that those with those underlying conditions are much more susceptible to the effects of COVID-19. Understanding what conditions you have is a crucial way to protect, your family and yourself during this time. I wanted to give you a quick quote here from the CDC that kind of speaks to this. Given this widespread reporting of medical care avoidance because of COVID-19 concerns, especially among persons at increased risk for severe COVID-19, urgent efforts are warranted to ensure delivery of services that, if deferred, could result in patient harm. So think about this, just as an example, unmanaged diabetes can have bigger effects than most people think. It can zap energy, strain the heart, raise stroke risk, damage kidneys, eyes, and nerves. So think about that. If somebody has unmanaged diabetes and they're putting off care, that really can't wait. And these people, unfortunately, if they haven't gone in the past year, are just getting worse. So that is one of the problems that we're having, with people not going to seek care throughout the pandemic. The other thing is, and we have another, and I forgot to mention, we have another question that I wanted to pose to the audience. Have you delayed a checkup or annual screening since COVID-19? Yes or no? If you wouldn't mind answering that question for us. And we will check the results in a second here, but this will be very interesting to see how the group answers this question. Wow. That really speaks very much to what we just talked about. A lot of people, as we have seen, have delayed those screenings or a checkup, 62% in this case. So really speaks to what we were talking about, and the need and why wellness is more important now than ever, really. The slide I'm talking about now here is really the mental health aspect. So we've found that adults with small children, or who are helping care for elderly patients, or parents, I should say, are typically experiencing the worst mental health issues during the pandemic. And this problem really ranges from the physical to the psychological in nature. Now, here's the big unknown, and I know a lot of people have seen this in the news recently, is what's the long-term effect? COVID is such a new, I say disease, but almost phenomenon in this country that nobody really knows what those long-term effects are going to be. We're seeing it now. It's starting to rear its ugly head in, children in school, the effect on people that are staying home, the effect that we just talked about in the physical nature. But again, the long-term effects are what we really have to start dealing with. It's almost like PTSD, actually. It's people do actually, doctors and people in the know have compared it to PTSD. So it can be not only physically devastating, but also psychologically, almost as bad as losing a loved one, losing a job. I have a personal, I guess, story to tell. I have a father who is 82 years old who got COVID back in December. He is actually still in the hospital 4 months later. He was the caretaker for my mother, who had kind of midterm Alzheimer's. Because she no longer had care, she had to go into a nursing home where she got COVID. So if you can imagine just the effect on my family and how that takes a toll, just, spread that around the country and the world. And there is a lot of, stress psychologically that is happening, with this disease, with which we can really help with a program that has some very comprehensive social aspects of it, mindfulness, those types of things that we can put in place to have people, at least give people a place to go to find ways to alleviate some of that stress. I wanted to put a quote here and read this to you. This is actually from Jim Lill, who's the chairman of Axion, and it really makes a lot of sense, especially in today's world. So to ignore a wellness-focused healthcare risk management strategy is like training for a marathon on the day of the race. We're going to discuss a number of strategies today to focus on the careful preparation and the homework, for lack of a better word, that we feel is absolutely necessary to implement a very successful well-being strategy. So in my opinion, an effective well-being program takes time. It takes a lot of upfront Q&A, finding out exactly what groups want in terms of a program, even, putting out a survey to the employees to see what, would engage them in a program. It takes time. It's a mindset change. It takes a while. So, Jim speaks to that preparation, not just throwing a check the box program out there, but really using best practices that we can supply to put together an engaging program in a multi-year approach. So what do we do now? I think the biggest things that we need to do are incent participants to get out and screen. As I said before, wellness programs are more important now than ever. We need to get people with those secondary factors to COVID, identify those, get that baseline, which means get the screenings done, analyze those results. So look at the aggregate report that's produced after the screenings are complete. Analyze those, see where those secondary factors are coming up, and then developing programming within the program to pinpoint and address those with those factors. So for example, some of the factors are diabetes, heart, lungs, those types of things. Really what's needed is to address those, get those people that have those conditions, for example, a diabetic, back down, under 99 for their glucose numbers, so that they're not at that risk for secondary factors for COVID as we go through this disease. And very importantly, when we're developing a program, it's all about defining your why. All the answers begin with that why. And some of the questions we ask when we're putting together programs for our clients are, who's the program designed for? Is it for healthy employees, those with health risks, spouses? Are we going to include spouses? That's an important aspect. We find that when spouses are included in a program, the engagement factor goes up, twofold, threefold. Having the spouses, involved in walking programs, those types of things, it just increases that engagement. What are we going to address? Which health issues? And that all comes from, really kind of drilling down on that aggregate report and finding those conditions, and then structuring the program to address those throughout the year. And then how do we know if we're successful? What's the report card? Is it ROI? Is it higher engagement, increased productivity? All of those factors we can measure, some with more ease than others, but we can still look at those factors and determine, how we're progressing throughout the years of the program as we go along. So here are some key components of a comprehensive well-being program. Obviously, the health screenings are a key component to get that baseline. Having educational and self-help tools. So within the program, do you have e-learning capability? Do you have webinars that are available to clients? Is that information geared and curated for each individual? So is the information being directed to the individual based on their actual results? So for example, if somebody in the screening has high glucose levels, and when they answer their health risk assessment, they mention that they're mainly sedentary, that's the large assumption there is that they're probably at risk for diabetes. Having that education and self-help tools directed to that client, very, very important. With our programs at CHC, we do that. We actually direct all of the different tools and resources to the client based on their results. Organized activities are huge to have an engaging program. So by that, I mean walking challenges, lunch and learn opportunities, even on or off-site company functions are huge when it comes to organized activities. Individual follow-up and treatment. So that's high risk notification. So when screenings are done, having a follow-up. So if somebody is out of range for a particular screening, one of the, for example, cholesterol, is a letter going out to them, mentioning that and asking them to go get follow-up treatment. If they're in a level 2 range over normal, is a physician reaching out to them to speak with them about that particular panel and letting them know that they should probably get some pretty quick treatment or follow-up. That's very important as well. Incentives. So what incentives are you putting together to have people go to that screening? Because as we all know, the more people you have going to the screening on site or remote for that matter, the better picture you're going to have, the better baseline you're going to have of your organization. And then finally, a supportive environment. Having that support top down from management, the C-suite buy-in, just that's big in creating a very engaging situation and the most participation in the program. So I wanted to mention WellCoA. WellCoA is the Wellness Council of America, and it's really one of the nation's most respected resources for building high-performing, healthy workplaces. And they've developed 7 benchmarks that are viewed as really the gold standard when it comes to developing programs or well-being programs within an organization. And really what I feel is one of the most important aspects is capturing senior leadership. We just mentioned that, but if we can get senior leadership to buy into the program, so what I mentioned it earlier, top-down buy-in, that is a very important piece of the puzzle in getting the engagement factor going in the organization. So I just wanted to throw out another statistic to you. Nationwide, believe it or not, the average participation in year 1 of a wellness program is 24%. I haven't heard statistics for this year yet or the past year, but I would surmise that, during the COVID epidemic, that's probably even lower due to a lot of factors, safety being one. But, beyond that, some of the reasons are resources, budgeting and time, engagement, leadership support absence. So it's highly important to get that commitment and that aligned leadership in place to get that the most engagement in the program. So really that's benchmark number 1 when we're talking about constructing a program. Number 2 is collaboration and supportive wellness. And what I mean by that is creating a wellness network within your organization. And what I mean by that is, a wellness committee, defining a wellness champion. Really, the hardest thing, especially in the beginning stages of putting a program together, is creating that interest and maximizing engagement. So you want to pick a person that has that energy, that can be that champion and mentor others. We actually suggest having a team of 5 to 9 members initially, meet monthly, define the roles and responsibilities, and really, most importantly, make the program from the employees for the employees. At CHC, we are always available to be a part of that wellness committee. We have assigned account managers for all of our groups that we have with CHC. And the account managers are actually incented to become a part of a wellness committee within our clients' programs. So very, very important to have that support and build that committee within the organization. Benchmark number 3 is collecting meaningful data to evolve a wellness strategy. So you really need to try and understand your actual unique population. What are your employee needs? An interest survey is a big thing here, and I'll show you an example of that next. Also gathering information about your workforce. Multidimensional, is it physical, mental, social, and even financial? The employee performance and engagement. So by that, I mean absenteeism, disability, workers' comp. And then information about the workplace. So what's your work environment? Does the organization show caring about the employees and that work-life balance? Your wellness provider really should be supplying those best practices for engagement with information from groups with similar industries and actually similar unique populations. So as an example, a blue collar company, the process and the engagement factor and how we reach full engagement is going to be completely different from others when it comes to techniques that we use to maximize that engagement. And we can really help with best practices in identifying, those techniques and the ways that we're going to have that engagement factor increased. This is just a sample of a needs and interest survey that can be used, that goes out to our clients, and we can definitely provide this and then analyze it, which will help us construct a program going forward. Another benchmark is crafting an operating plan. 10 things that I think are very, very important in crafting that operating plan. Because really what it does is it ensures your program will address your organization's values and your employees' needs, which is very important. Number 2 here is planning is dreaming. I call that brainstorming. So really just having everybody brainstorm and nothing's out of the question in terms of what you're talking about when you're building that program. Having a vision is huge. So really imagining your program 3 to 5 years into the future, what you feel it will look like, who will be driving it, and what you want to accomplish within that 3 to 5 year time frame. Using words that echo your organization's broader culture. What I mean by that is really streamline and just have a plan. So number 5 is a good plan today is better than a perfect plan tomorrow. What I mean by that is just have a plan. Have a plan in place. It doesn't have to be perfect, but it can be a framework that really can be built on and updated down the road. Share that plan. That really speaks to the buy-in across the organization. And number 7 is completely true. It definitely does take longer than you think in planning, as far as in making that mindset change. Keep it simple. Anticipate every question that could come up while planning and develop good short answers. Use your company's planning process. So really no need in reinventing the wheel here. And then number 10 really should be obvious, but one well-being program is one well-being program. You really want to come up with your own, because you are your own, your group is your own unique group. So, and again, using your account manager, your assigned account manager who has years of experience helps in crafting and bringing up some best practices when you're coming up with your plan. And choosing initiatives that support the whole employee. I wanted to show you real quickly here a program that Wellcoa partnered with the state of Wisconsin. Some really good stats here I'm going to show you in a second. So what this was a pilot program that was aimed to combat sedentary behavior. So the challenge triggers positive habit changes, which make people continuously active throughout their daily life. The more active a person is, the healthier they become. The healthier they become, the happier their life is. Let me tell you about this challenge, and I'll show you in the next screen what this was about. So to participate in this challenge that WellCo put together with the state of Wisconsin, companies must have 30% of their employees engaged throughout the 12-week program. In its pilot year, there were 40 companies taking part in physical activity and educational components. So let me show you some of the results that happened in this challenge. So again, it was a 12-week challenge, 40 companies, 8,500 people participated in the challenge. And after participating, just look at what the results were. 130% more employees were physically active at a moderate intensity level every day. 41% more met those CDC guidelines of moving at least 30 minutes a day, 5 times a week. People were losing weight. 25% more lost weight, improved aerobic capacity. Sitting less. Reducing their sitting time outside of work to under 2 hours, and the increase in employees believing their organization supported them in their physical activity efforts was 11%. So we had some major increases here when they did that challenge. And one of the most important parts of the challenge was the influx of a walking program. And what I wanted to show you here, and this is super, super important, is the benefits of putting a walking program in place. We're going to have another poll question that's going to pop up regarding walking, and then I'll go through some of the stats on just the impact of walking 5,000 steps a day. So if Maggie, if you can, oh, there it is. Perfect. So question number 1. Do you currently have a walking program within your organization? Yes or no? And then I'd love to know how many steps per day is your goal in the program? And then we'll wait a second for the results here, but this will be very interesting to see.
And Todd, in the meantime, while we wait for the results, I'm just going to chime in a little bit with the clients that we've worked with on the Axion side. We had several do walking challenges over this past year during the pandemic, and really it was so beneficial for them to have that camaraderie through the walking challenge when, they were doing teams and they could come together, and it gave them a sense of community while they were also working remote from home. And they were getting outside and they were moving. So it was, they really found a lot of benefit in it. And a few of them are even repeating these walk-in challenges now quarterly. So that is a good news story.
Thanks, Amy.
Yep.
And here are the results. I was really excited to see how these turned out. 54%, over half, do have a walking program in their organization, which is great. And then the step challenges is what I wanted to see here. So goals, they're all across the board here, but the leader here is 10,000. And 10,000 is, the gold standard when it comes to having, a program. People strive for those 10,000 steps. The thing that we see though is, not everybody's able to walk 10,000 steps a day, and we don't want to disincent people by having too lofty of a goal up front. So we actually at CHC did a 16-month independent study of participants with metabolic syndrome and put them on a program of walking, just trying to get to that 5,000 threshold per day. And in that 16-month study, the results were absolutely amazing. Pre-diabetics, so anybody who had glucose numbers, over 100, their status went back to under 100. 38% of them actually dropped down to a healthy status within this program. 78% with high blood pressure moved to medium or low risk categories, and 9 pounds average were lost, while the non-participants actually gained weight. Walking has so many benefits, not only in the physical aspect, but it also trickles into the emotional and social well-being, the camaraderie factor, as Amy mentioned, the competitive spirit. Having, walking challenges out there that, engage employees, whether it's team-based, map-based, so walking from different areas on a map, or even individual-based. Just getting people out and walking, especially in times of COVID, where people are kind of shut in, starting to get out. Now's the time. This slide here just says it's the greatest and most immediate impact on COVID secondary factors. I did mention those secondary factors are diabetes, hypertension, or coronary artery disease, overweight and obesity. It alleviates and gets people moving and starts to really help alleviate a lot of those secondary factors. So I can't stress enough, having a walking program within your overall wellness solution makes a lot of sense. And again, it doesn't have to be that 10,000 step threshold. This is just some more information on that WellCoa program, just pre and post, becoming more active, looking to be more active in the future. So it really did engage people and get them thinking more into that well-being mindset. Benchmark 6 here is just cultivating that supportive health promoting environment, policies, and practices. To show you what I mean by that, just showing you here just a sample policy and procedure template that we definitely suggest that our clients put together. So putting together goals, objectives, the scope of the program, who's it's going to apply to, who's responsible, and then what type of communications will be put out and forwarded within the program. Your wellness program should be able to do a lot of the marketing to nudge employees, not only from an email perspective, but also from a text messaging perspective, actual print, all types of communications. Very, very important, just to increase the touches in the program to get people, front and center in a well-being mindset. Conduct evaluation, communicate, celebrate, and iterate. So, we really want to make sure that the data collected during the evaluation will help determine how successful the approach has been. We evaluate that, and then in what ways can it be improved? So within our programs, our account managers are instructed quarterly to evaluate the program, just to make sure it is running as well as it should be. Maybe make some tweaks along the way to increase engagement, maybe a CEO letter at some point, all of the different marketing that I talked about, and then celebrate that success. Announce those positive milestones that you're uncovering within the program and share that with your participants. Very, very important. So really, where are we headed now that we've gone through the milestones? Where are we headed? And what I see are really three big trends, especially in times of COVID. One of the things that I'm seeing here is total well-being versus the physical wellness. So these days, financial well-being is huge. Emotional, mindfulness, meditation, personalized mindfulness. So, live webinar type experiences, things like that, where people can address different things from an emotional standpoint within the program. Financial, having people assess their financial needs and then getting support within the program to alleviate some of those concerns or to learn more about those topics. Even having the ability to reach out to a financial advisor through the program is huge. Increasing the personalization is also huge. So I mentioned earlier, curating content to each individual based on the results. It kind of closes that circle in the well-being program, whereas before they would be able to go out and just kind of, go through all the vast ocean of different resources and tools. Now, curating that content to the individual's results, that is really another big trend that we're seeing. And then combining high tech and high touch. High tech meaning, having that app. So, people are all over the place now. They always have their smart device with them though. So having that app available to access all the tools and resources that are available, and then high touch. So the engagement factor, the ways that we reach out through different modalities, whether it be text messaging to remind our participants of certain things within the program. Maybe it could be email or chat features within the program. Just many different ways for our participants to be able to communicate not only with the wellness program, but with other participants as well through chat features, those types of things, just to kind of keep that engagement up. So another trend that I definitely am seeing and we are seeing out there is total well-being. So increasing on-site stress management programs, we're seeing a 13% increase. And again, the source here is the Bank of Merrill Lynch. 56% of employers are now providing tuition assistance, which is a big number. Mindfulness or meditation, as I mentioned before, 11% of our clients are seeing that and increasing that and including that in their programs. And then non-retirement financial counseling, 36% of groups are offering that as an option into the total well-being realm. Increasing that personalization. So creating personal pathways based on preferences. So our individual preferences on an individual basis, that means. Creating goals within the program, activities, the health assessment, biometrics, and claims. So really giving individuals more control over their actual journey and then having the program meet them where they are. And then designing effective rewards. So a big part of an overall wellness program is having a rewards program. They are very, very customizable. We can help offer a lot of best practices, again, based on industry, based on unique populations, in not only the rewards that are available, but how frequently they're granted, how much value does each reward carry. So for example, if we're incenting somebody to go and get their physical exam done, that's a pretty big deal. That may carry more value than having somebody do an e-learning activity. That specific mix of activities or outcomes and why we should have differences based on different point structures, different point values. We can help with best practices when it comes to that. And then how are rewards verified? There's the ability to reward people for doing things within the portal, but there's also the ability to have participants send in proof of an event that can come right in to us through their smart device. For example, running a 5K, we can incent people to run a 5K or to go to the dentist. Send in proof, we can review that. Our operations team would review that and then assign points into their rewards program. So there's a lot of ways that we can do things outside of the portal just to expand that rewards program and make it even more engaging to the participant. I know that we are at about 10 minutes. I just wanted to mention that any type of personalized consultation, there is this website, and I will send out the link after our program. You can always also contact your Axion representative. So I wanted to make that known. And then I wanted to open it up for some questions. And if we do have the chat feature open, if there are any questions I can answer via the chat.
Yes, I do. I did receive a couple questions. One being how to begin, first steps, baby steps, if a company has a minimal budget as well as minimal time to spend on this.
Okay, that's a great question. We get that a lot. So that's really the beginning factors of the program. And there's a couple ways we can really structure a program for those who are just starting. And our program is completely customizable. So in that regard, if a group is just starting, I would always suggest getting at least the screening done and the basic portal. And why I say that is, having the on-site screenings, we're getting that baseline. So you're at least getting a good picture, not only from the physical aspect, but also from the emotional and social, as well as financial aspect through the health risk assessment. Getting that baseline gives us an opportunity to review with you the aggregate report data. We'll get a good picture of how the group looks from a wellness perspective and all the different modalities. And then we'll be able to start to address some of the concerns that arise within that aggregate report with a full year of programming. So getting that screening done is of utmost importance. If price is a factor, the other route I would suggest is just offering up the portal resources. So we do have a very, very comprehensive, engaging portal that's also available on a smart device, as I mentioned. And that has a lot of tools that really can start to at least begin to get that well-being mindset started, incenting people to do maybe some e-learning activities, some webinars, maybe a few challenges throughout the year. So a lot of our groups are doing, some basic walking challenges, even hydration challenges. That's very, very important. Just to get that camaraderie factor up and get people into that well-being mindset. So I would suggest, one of those two options if you're just starting out in the program.
Okay, thank you. And one other one, how do we gain support if it's not a priority with leadership?
Another great question. And we can help with that gain of support. We have a number of sample letters that can be shared with leadership. They can kind of make it their own. So, at least trying to get a letter from leadership that goes out to the population saying, hey, we're putting this program together. We believe in it. We're going to be participating as well. And there are a lot of great tools and resources that we're going to have available for you. Not only that, but if you're doing the screening, we're going to be able to, you're going to be able to see your results within the portal. And, a lot of different ways we can kind of try to incent the employees through leadership just by some of the sample letters that we have to offer. So sometimes it can be a tough sell initially, but showing some of the positives from the program, and we can assist with that too in terms of what's available to the participants within the program. Hopefully, we'll maybe tip that scale for leadership to agree with starting the program out, as well as hopefully getting that letter out to the population just to show that they're engaged in the program as well. Hopefully that answered your question. But there are a lot of ways that we can help with that and assist.
Okay, thank you, Todd. I don't see any other questions. So now for the big reveal, I can do the list of, or spin the wheel of names and see who wins their Fitbit Inspire 2. So if you don't mind, I'm going to share my screen so people can see the wheel because it is fun.
Very exciting.
Okay, I've got the wheel and I gave everyone a number. So here we go. Just click this center dot and see what number pops up. And here, so, and 14 is Lindsay Alberts. So
Right.
Lindsay, congratulations. Thank you for joining us, and we'll be in touch so we can get where to send your Fitbit Inspire 2.
Congratulations, Lindsay.
Yes, congratulations. And I'd like to thank everyone again for tuning in. And if you have any questions, please feel free to reach out to me, Jake, or Todd, and we're happy to answer those. And have a great day.
Thanks, everybody, for your time. I appreciate it.
Thank you.
Bye-bye.